So who really cares? Value, I think, like beauty, lies in the eye of the beholder. And like definitions of beauty, what constitutes value is going to change over time. And given that we're an industry in transition, we are very much looking at changing definitions of value. So this is very much a moving target, and it affects all parts of the healthcare system. When you have that, it's very difficult to plan, very difficult to determine where to invest, what products to bring to market, what kind of capabilities you need, what kinds of business models are going to make the most sense, unless you're able to see what's not there and connect the dots and make reasoned projections about what the underlying dynamics are and how that's going to translate into value equations that make sense for very specific populations. So let's take a look at our first group, the group that everyone loves to hate, the payers. They are clearly under a great deal of pressure to reduce costs, and they're very interested today, which was not true even 5 years ago, to begin to lower their exposure and share risk with providers. We're engaged with a number of payers around the country working to identify those providers that have the capability to begin to look at bundled pricing and predictive care paths, something that most of them have not even thought about until the last year. They clearly want evidence to make sure that what they're bringing to market, what they're agreeing to reimburse is going to make a difference. But they've tended historically to have a very short-term view. The usual time horizon for most payers has been somewhere in the neighborhood of 18 months, and on a good day, 24 months. And the reason that they've given for this kind of a time horizon has generally been because members that are covered under a particular plan tend to move from plan to plan. Imagine what would happen if a particular payer really had a business model that was focused on individual consumers regardless of where they worked. It was not just employment-based, or they had a relationship with a particular employer who still wanted to support employer-based models. And members were really incented to stay with that payer for a long haul. It would totally change the dynamics, and they would be very focused on a much longer-term view. Increasingly, they're very interested in looking at things like patient outcomes, patient management, compliance, side effects, and so forth, and baking this all in to the value equation that's important for them. And I should add here, it depends on which payers, and it depends on who you talk to in a given payer organization. Because not all payers are in this game together, and there are still employees within given payer organizations that are very much focused on the business model of today, so that they are not incented to think about alternatives and think strategically. There are mixed reactions when we're talking about patients. Many of them who either heard about or grew up in the 80s and experienced HMOs are very interested in not repeating the mistakes of the HMOs. Their concern is basically, what am I going to lose? But there's another group that is one that concerns me, and that's the group of patients that basically says, why should I care? Does this even make a difference? Why should I be concerned about value? Somebody else is paying for it, whether it's my employer or the insurance company, and the doctor and I never talk about cost and never talk about relative value. Fortunately, that group is beginning to decline in relative proportion. And the third group, which is one that really interests me, is the group that wants to be an informed consumer. This is the group that tends to be focused on high deductible health plans. They're the ones that have had these for quite some time. They have health savings accounts. They're very interested in understanding relative benefit and cost over a long period of time. Consumer Reports has tapped into this audience, and about 5 years ago made a very large set of investments in an entirely new business approach where they are focused on providing information in a transparent and comparative way about various kinds of treatments. One of the things that really intrigued me a number of years ago was that Consumer Reports did an excellent piece taking a look at infection rates and general safety across various hospitals in this particular country. And I think it's ironic that it took Consumer Reports to do this as opposed to the agency that is supposed to be regulating the safety of what goes on in hospitals. But in any case, there are now definitions of various infection rates. All of this is being published. Imagine a consumer guide to healthcare delivery, ranking various institutions on a number of different dimensions. Imagine that they take a look at medical devices and different kinds of implants. Imagine that they take a look at pharmaceuticals and begin doing their own investigative work, doing comparisons so that patients, consumers are not just relying on information on the internet that may or may not be the quality that we in the industry might think would be appropriate. There's a general trend from illness to wellness, from sickness to health, and for those people with rare diseases, I think this is really important because as I look into the crystal ball and begin laying in what's going to happen in the future, I think that this becomes a wonderful opportunity for investment. If we look at employers, one of the things that we see is very mixed reactions, kind of like the patients had mixed reactions. They're trying to figure out how do you navigate this complexity. They're under great pressure to cut costs, and they are in turn putting pressure on payers who pay the payer's bill largely to be able to make different decisions, and they're not so sure that some of these wellness programs that have been touted as bringing down cost, in fact, have the effect that they would like. We see some very interesting carve-outs in the market. A couple of years ago, Lowe's and Cleveland Clinic did a carve-out in cardiology services. We see international trends in medicine being practiced overseas with medical tourism. We're working with a cancer institution and taking a look at carve-outs even in the area of cancer. Let's take a look at our providers. They are under incredible pressure, and many people don't realize just how much pressure the provider community, whether we're talking about individual physicians or we're talking about large healthcare institutions, they have to meet demands for better care at lower cost, and they are really under pressure to be able to manage under increased transparency. Most of these institutions have benefited greatly by not having to publish what it costs to get fill in the blank imaging or procedure, etc. All of this is under scrutiny right now and is likely to change. We're working with leading institutions to focus on predictive care paths, bundled pricing, ultimately looking at things that demonstrate real value that will have transparency and a consumer or patient-centric model behind them. At the same time, there's been a mass exodus of doctors from private practice. Many of them have gone out of business because they were at a point close enough to retirement to be able to do that, and others are lining up and seeking employment in these large institutions.